In the last 6 months, public hospitals across Queensland have come under pressure. Federal funding has been pulled and jobs continue to be lost as part of the state government's austerity measures. The cracks are now starting to show, as thousands of people waiting to see a specialist have had their appointments cancelled indefinitely. Josh Bavis reports.
This small medical centre at Logan on the southern outskirts of Brisbane sees hundreds of patients each week. One of the GPs, Dr Thomas Lyons, knows nearly all his patients can't afford private health care. It's his job to refer them to specialist outpatient clinics for further testing, but now most of those appointments have been cancelled indefinitely by the hospitals.
So it's gone from a finite measurable amount to just an open-ended, no, we won't be issuing an appointment for the foreseeable future.
He says that means they don't know when their case will be followed up, and that's left many of his patients in a worrying position.
One gentleman, he's approaching 50 and he has been working, but he's torn his shoulder and he will be able to return to gainful employment, but he needs surgery. He's been given a Category 2, which means he may not be seen anytime soon. So his debility from his shoulder is just deteriorating. He's having trouble driving, trouble picking up things at work. One lady, she's 47, has an abnormal pap smear. They wanted to see her soon in November, but the doctors weren't aware that her appointment had been cancelled, so we're trying to get her in urgently now just to make sure her abnormal pap smear hasn't progressed to cancer. Another gentleman was seen in November last year with a high prostate number, the PSA, and they wanted to see him soon. Then as a Category 2 would have been 6 weeks, but they weren't aware in November last year that in January it would be cancelled. So the doctors in the urology clinic at PA weren't aware. We don't know until we do a biopsy on him what the state of his disease is. And there's a lady who's suffering enormously and can barely drive or walk without leaning heavily on a stick. She has bad osteoarthritis in her hip. She'll either have to conjure up $10,000 up front, which she can't as a pensioner. She's had to let a car go, and she'd be waiting years to be seen. So the disease burden is enormous.
The state and federal governments are blaming each other for the reduction in health services. In November, the federal government pulled more than $100 million from the Queensland hospital system after revising population figures, but much of that money was already spent. Each of the 18 health divisions across the state lost varied amounts of federal funding. At the Princess Alexandra Hospital, it's meant all non-urgent elective surgery and Category 3 outpatient appointments have been axed. That means any patient with a condition that is not immediately life-threatening doesn't know if or when they'll be seen.
That's a very significant decision that hospital has made, and that's purely because of budget, in order to come under budget. And so that does have a flow-on effect for patients and the ability for them to access services and care.
But this dashboard is 6 key areas which we think emerging.
The Health Minister says Queensland is investing heavily in health with about $12 billion this financial year and still needs to push on with its job cuts. Up to 770 nursing positions and more than 3,500 administration jobs have been terminated in the last 6 months.
We've had to deal with the cost of the infamous payroll bungle in Queensland, which has meant that $150 million for just running that was unfunded by the previous government, and what we have done is had to divert that $150 million, equivalent to 1,500 jobs, just to keep that system going this year.
This Brisbane woman, who doesn't want to be identified, is waiting to see a specialist at the Princess Alexandra Hospital outpatient clinic about vascular problems in her legs.
I got a letter 2 days ago that now tells me that it's just all been sent back to my GP. Basically, I'm on a waiting list, but how long that'll be, they can't tell me, and that it's now been sent back to my GP for management, who couldn't manage it to begin with.
But Thomas Lyons says GPs are struggling to cope.
This adds more time onto me, but I have to make sure if my patient has a potentially dangerous illness that I ring them up, shake their tree and get them recategorised. So now if they have suspected or potential cancer, they're trying to categorise them as a 1, so they will be seen. If they give them a 2, they'll never be seen.
Now you can judge the performance of your local hospital and health service on things like waiting times. Just keep an eye out for the first of our quarterly performance reports, published soon.
This week, the government is launching its health data website. It will make Queensland the first state to publish such elaborate figures on hospital performance. It includes some statistics on how long people have been on waiting lists. To date, the results show 90% of patients have waited anywhere between 3 months to 4 years when listed as Category 2 or 3. But the website doesn't include those who have had appointments cancelled. Those figures are still being calculated. And those affected say these patients are more than numbers.
This is dangerous for Queensland. People will be dying younger.
It's pretty disheartening, and it's a worry because not just the fact that it's painful, but it could lead to serious complications down the track. You know, people lose limbs with this kind of disease in the future. Yeah, so it'll be really, I'll have to very carefully manage this myself and hopefully rely on what knowledge my GP has.
Queensland Health says it's waiting to hear from the federal government in the new financial year before re-evaluating specialist outpatient services.